Dear students, welcome to Bluepin Online. Shall we begin? Please use headset, pen and paper to take notes.
Here you go. Please let's know your feedback after class.
Mediastinum. It is a potential space between the lungs and the thoracic cavity. It is an interpleural, so which is limited by thoracic inlet superiorly, diaphragm inferiorly, sternum anteriorly, and posteriorly thoracic vertebra, 12 thoracic vertebra. I'll show in the picture. See, this is the thoracic inlet and this is the thoracic outlet. Okay.
Okay.
So see, this is the mediastinum. These are the two lungs. Okay, this is inside the chest cavity actually. So two lungs, between there is a space, that is the mediastinum. So mediastinum we can divide it into two, superior mediastinum and the inferior mediastinum. Again, superior mediastinum is between your first rib and the sternal angle, correct? No?
Yes, ma'am.
Inferior mediastinum lies between your sternal angle and the diaphragm. So this is your inferior mediastinum. Got it?
Yes, ma'am.
See the next picture. So here also you can see this level will be the superior mediastinum and just below will be the inferior mediastinum. Okay. First we'll study the superior mediastinum. So anteriorly manubrium sternum, posteriorly thoracic vertebra number 1 to 4, and sides will be mediastinal pleura and the plane of thoracic. Superiorly will be the plane of thoracic inlet. Inferiorly there is a imaginary line which is connecting from sternal angle to T4. This is the sternal angle to T4. So that is the boundary. See, here you can see the contents of the superior mediastinum. Like muscles, there are three muscles will be there: sternocleidoid, sternothyroid, and longus colli. And thymus organ will be there, trachea will be there, esophagus will be there, and important arteries like arch of aorta, brachiocephalic artery, left common carotid, left subclavian artery, thoracic duct will be there, and lymph nodes will be there. So these are contents of the superior mediastinum. Okay.
Okay, ma'am.
Again, we can divide the inferior mediastinum into three: anterior mediastinum, middle mediastinum, and posterior mediastinum. So first let's study the anterior mediastinum. So anterior mediastinum boundaries are anteriorly sternum, posteriorly pericardium, sides by pleura, and top by the imaginary plane, inferiorly by the diaphragm. Okay. So middle mediastinum, next is middle mediastinum. See, we can divide it into three actually. This is the anterior mediastinum, this is the middle mediastinum, and this is the middle mediastinum. See, this is one, middle mediastinum.
Yes,
The
ma'am.
total we will tell this is the inferior mediastinum, superior mediastinum, and just below this big portion is the inferior mediastinum. Within the inferior mediastinum, we divided into anterior, middle, and the posterior. Clear?
Yes, ma'am.
So next about the middle mediastinum. So heart will be there basically. Arteries, ascending aorta, pulmonary trunk will be there. Superior vena cava, azygos vein, pulmonary vein, nerves, phrenic and deep cardiac plexus. Okay. Then you can see the bifurcation of trachea with the two principal bronchi and tracheobronchial lymph nodes. Okay. Then posterior mediastinum, the backside, anteriorly pericardium, bifurcation of trachea, posteriorly T5 to T12 vertebra, then superior transverse thoracic plane, inferiorly diaphragm, sides like a mediastinal pleura. These all structures will be there. Okay.
Okay.
Then inferior mediastinum means you can see the esophagus, aorta and branches, azygos and hemiazygos vein, and vagus and splenic nerves. Thoracic duct will be there, lymph nodes will be there. So these all are the contents of the posterior mediastinum. So what are things we studied now? Mediastinum is a space in the thoracic cavity between the lungs. It is divided into superior mediastinum and the inferior mediastinum. Inferior mediastinum, superior mediastinum is between the sternal angle and the thoracic vertebra number 4. And just below that is the inferior mediastinum. Inferior mediastinum is divided into three: anterior, middle, and the posterior. So that mediastinum's boundary and content we already saw. Okay. Next about the mediastinitis. So from the word itself, you know, it is an inflammation. So example, like facial spaces of the neck, example, pretracheal space, retropharyngeal space. So all this extend below into the mediastinum inside the thoracic cavity. So deep infections, what will happen? It will spread into the cavity, causing the mediastinitis. And another syndrome is mediastinal syndrome. So what is happening here? There is a compression of mediastinal structures by tumor or cyst, something like that. So that is the mediastinal syndrome. So what will happen in these cases? There is an engorgement of veins will be there because of the obstruction of the superior vena cava, and difficulty in breathing, that is dyspnea, and dysphagia, that patient can't swallow, and hoarseness of voice, and erosion of bodies of thoracic vertebra. So these all things will be there as a symptom for the mediastinal syndrome. So the reason is compression of the structures by any growth, tumor or cyst. Okay, the next clinics is widening of the mediastinum. So widening of the mediastinum, you can see in the chest radiographs. So that is maybe because of different reasons, due to hemorrhage of mediastinum from the great vessels kind, superior vena cava, inferior vena cava, or head-on collision, trauma, or some lymph node enlargement because of cancer, and enlargement of hypertrophy of the heart because of congestive heart failure. So these all are the reason for the widening of the mediastinum. Another clinics of the mediastinum is mediastinal shift. That is common actually in the case of lung and pleural pathology. So here what is happening, where it is affected, diseased, mediastinum is shifting into that side because of the reduction in the lung volume and decrease in the intrapleural pressure, as in collapse of lung. So the mediastinum shift to the healthy side when the intrapleural pressure is high on the affected side, as in the case of hydrothorax and the pneumothorax. Okay, so that is the mediastinal shift.